you for the opportunity to be heard.
Thank you. Ms. Meister. Sorry.
Good morning, Lauren Meister, West Hollywood. Thank you for inviting me to speak today. I've been an individual plan member of Blue Cross of California, now Anthem, for over 17 years. I've always dealt with the company directly, not through an agent. Like many people, in 2008, my income dropped substantially. I was paying a $500 monthly premium for Anthem's PPO 500 plan. I called Anthem in December of 2008 to see what other less expensive plans were available. I expected the plan would have a higher deductible or copay, but would still have the basic necessary coverage. The Anthem rep was aware of my budget, my medical history, and age. I was turning 49. She recommended Anthem's PPO 1500 plan, which was about $1,000 less per year, so I switched. Just a few months later, I received a notice from James Oatman, VP and General Manager of Anthem Blue Cross Individual, that rates for the PPO 1500 plan were being increased in March of 2009, and that the new monthly premium would be $528, even higher than what I'd been paying for the PPO 500 plan, but with less coverage. I paid the new premium until I spoke with friends about their plans. In October, I called Anthem again and asked them how the PPO 40 plan with brand RX coverage differed from the PPO 1500 plan, which they had recommended to me in 2008. I was told by this Anthem rep that the PPO 40 plan had a lower monthly premium, no deductible, and a higher copay, but the main difference was it did not cover maternity, which at 49 I probably didn't need anyway, so I switched plans again. At 49, I'd been paying for maternity coverage, a costly, unnecessary benefit. I thought Anthem execs should know, so I wrote a letter to James Oatman, and I copied Ms. Angela Brawley, Ben Singer, Director of PR for Anthem Blue Cross of California, as well as Senator Boxer and Congressman Waxman. The only response I received was from Congressman Waxman. Excuse me. In January 2010, James Oatman finally did send me a letter, but this was to inform me that my rates were being raised once again, from $373 to $516 per month, an increase of 38%. The letter noted that I'd also have the option to change to PPO 40 plan with generic RX coverage only. This alternate plan would increase my premium by only 16%, as if a 16% increase was a great savings. I have allergy asthma, and I take brand prescriptions Accolade, Arabid, and Symbicort. Symbicort is fairly new. Accolade will not be generic until probably 2011. Hopefully, I can hold my breath until then, literally. For the record, with the proper medication, my breathing capacity is nearly 100%. But without the proper medication, I may end up needing more health care services, which ultimately will increase medical costs for both me and my provider. Pre-existing conditions, such as asthma, limit one's chances of being able to switch to a different health care provider, particularly if the goal is to lower the cost of the premium and still maintain coverage. This is only one of many reasons why we need health care reform. I read that Anthem's explanation for increasing rates by up to 39% was rising medical costs. In one respect, Anthem is right. It shouldn't cost $20 for a hospital to administer an aspirin. But then Anthem's executive salaries and stockholders do not appear to be suffering. And how much money goes to lobbyists trying to prevent health care reform, the same reform that Anthem indicates is necessary to keep health care costs from rising? My issue with Anthem is shared by many and is just a symptom of a broken system. We have a system where prevention and wellness are not encouraged nor embraced. For example, because I was turning 50, my doctor prescribed a bone density test for a baseline measurement. Anthem Blue Cross did not cover one nickel of that test, even though that test could determine if I had a propensity for osteoporosis. Penny wise, pound foolish. It's obvious the healthcare industry needs to be regulated. We saw what deregulation did to the cost of utilities in California. We saw what the lack of regulation has done on a global level to our financial and banking systems. Well, it's having the same effect on our healthcare system. If the city of West Hollywood, where I live, can regulate how much landlords can raise the rent each year to keep rents stabilized, why can't the federal government regulate how much insurance companies can raise their rates per year in order to stabilize premiums? I believe that we should all be able to buy health care coverage. If someone can afford to pay for private insurance, great. But if not, there's got to be a public, not-for-profit alternative without having to move to Canada, England, or France. Some representatives from Congress have stated that we don't need a public option. I say to them, I just want what you have, nothing more and nothing less. To me, insurance is like marriage. You expect the insurer to be with you in sickness and in health. That's why we buy insurance. If the insurer can't live up to this expectation, then perhaps they need to get out of the business of insuring. I also want to just reply that I'm an American and I support Obama's health plan. And I just wanted to make that clear. Thank you.
Thank you, and thank you all for your testimony and for coming here today. We're going to start with questions. We'll start with the chairman of the full committee, Mr. Waxman, for questions, please.
Thank you very much. I appreciate the testimony each of you has given. Ms. Meister, you indicated you're a constituent. I don't know if the other two witnesses are also constituents because you're from L.A. I do know that WellPoint is a constituent of mine as well. And I want to do what's right for